My name is Rose Stewart, and I am a consultant clinical psychologist and the lead for diabetes psychology in Wales. In my day to day job as a diabetes psychologist, I work with lots and lots of people with type 1 diabetes and lots of those people who are also neurodiverse. When you're living with ADHD and type 1 diabetes, getting organised can be really, really tricky. And sometimes we need to put in bits of extra structure in the world around you to help you to feel more organised. So, some things that can really, really help are to have visible reminders of your diabetes tasks. Because if you are somebody who finds it difficult with paying attention and getting distracted, you need reminders for your brain to go, oh, yeah, that's what I need to remember, and this will help me with my diabetes. So, you could use things like lists, you could use things like apps on your phone, you could use things like pictures or sticky notes. Something that can be really helpful is keeping your diabetes kit somewhere visible where you can see it. I so often have this experience working with people with ADHD and type 1 where they often keep their insulin in a completely different room to where their food is. And of course, you're not going to remember to do it. So keep it visible and make it really, really obvious. One of my favorite ever tips for somebody with ADHD and type 1 came from a gentleman who was really struggling to take his insulin before meal times. And the way that he fixed it was to work with his son to build a Lego model that would hold his insulin, and it sits on his dinner table and it reminds him to do his insulin before food. So this doesn't have to be boring. You can make it really fun. And I'd really recommend changing it up frequently because our brains get bored of these things, especially when we're living with ADHD. It's also really common for people with ADHD to have a bit of an all or nothing approach to managing their diabetes. So you might well have been through phases where you felt really burnt out, it's felt really difficult to get on track with your diabetes, and maybe things have subsided when it comes to your diabetes care. And maybe you've had a sort of realization, oh my goodness, I need to get this together. Maybe you've had a clinic appointment, maybe you've had an HbA1c that wasn't where you wanted it to be. And then people take this really all or nothing approach where you become obsessive about managing your diabetes. And that then, because you've got a busy life to lead as well, becomes untenable. It means that you can't keep going with it forever. So it's really important if you're trying to improve your diabetes management to try and take it one step at a time. Focus on something really small, really basic, get that bit nailed in, and then start building. So, I often, when I'm working with people with ADHD who've completely burnt out with their diabetes management, we will often take it right the way back to basics. So, we will start with long acting insulin. We will start with, okay, are you taking this every day? Are you changing your needles? Are you injecting in the right spots? So take it right the way back to basics. Get that bit really working, really effective, and then build up slowly. You don't have to do it all at once. And it's so often the case that if people try to do too much, they become overwhelmed and they end up burning out again. So get those basics right and use them as a foundation point to build gradually, and you will get to a place where it feels like things start to run automatically for you.